I grew up just outside of Red Springs, about 3 miles towards Prospect. I went to school at Prospect up until my senior year when they consolidated the schools and moved into West Robinson. That was where I graduated from. At that time I was working at Hardee's in Pembroke and had a lot of friends in Pembroke, which is where I met my wife, and we eventually wed just prior to moving to Rochester, New York for training, and now we have 3 kids. My grandmother, when I was growing up, had several chronic illnesses, diabetes, hypertension, and at several times she had minor heart attacks. My parents also raised Doberman pinschers and sold those. And I always kept the runt and sort of nursed it to good health before we would sell that puppy as well. And so the combination of the two got me interested in medicine, and then when I was at UNC, I was able to volunteer first in the emergency department and then eventually in the operating room. And in the operating room I spent a lot of time watching open heart surgery and was just completely amazed at how they could stop the heart and do the things that they did and then start everything back up again. So really that was the stepping stone to becoming a heart surgeon. Once I graduated from West Robinson, I matriculated to UNC Chapel Hill, where I did my undergraduate training. I got a degree in clinical laboratory science, which is basically working in the clinical labs in the hospital. My ultimate goal, however, was to go to medical school, and using that sort of as a stepping stone, I was able to get into medical school and stayed at UNC for that training prior to doing a surgical residency. Duke, of course, plays a huge role in the Heart Center. I'm an assistant clinical professor at Duke, which basically means I'm one of the staff surgeons for the university. However, instead of living in Durham, I live in Lumberton and I work in Lumberton. So really the Heart Center is an extension of Duke, so that patients no longer have to travel to Durham in order to get heart care by the Duke cardiologists and Duke surgeons. They can receive that care in Lumberton. I think the Heart Center is having an impact certainly because a lot of the patients who need cardiac care and certainly cardiac surgery, it's a hardship for them to have to travel back and forth to Duke and then to go up there and spend time away from family and friends. So really the Heart Center eliminates that need for them to go up there. Not in every single case, but in most cases those patients can stay here and have their treatment in their hometown where their friends and family can visit, and it's not a financial hardship. At the same time, the Duke cardiologists are here and working together with some community programs and having community activities to try to increase awareness about heart disease in Robeson County, provide some teaching opportunities and some screenings where participants get to learn about vascular disease, diabetes, hypertension, smoking, all those things that contribute to forming heart disease. So I think the Heart Center is going to have it already has a big impact, and it's going to have a more significant impact in the future as we continue to grow and do more of these types of activities. I think the 100th patient was certainly a milestone in that we sort of run the gamut of doing some patients who were quite sick and had multiple medical problems versus the ones who only had the cardiac disease. So not only the surgical team and myself have had the experience of those 100 cases, but we've been able to manage those patients in the Heart Center and take care of all the problems that they encountered during the time that they had their surgery. So I make it basically results in a great experience for the staff, for the nursing staff, as well as for the surgical team. So I think that was a big milestone in the development of the program. Second anniversary is also important because it, I think, continues to show the commitment of Southeastern Regional Medical Center to stand behind the Heart Center, as well as the commitment of Duke to stand behind the Heart Center and have a quality program that basically mirrors the program and the care that you would receive at Duke. So the care begins with 24 hours a day, 7 days a week, availability of the cardiologist to see patients in the hospital, in the emergency department, and in the clinics. And then that extends over into the cardiac cath lab and as well as cardiac echo. So whenever we do an open heart surgery, you always have two surgeons available. If something were to happen to one surgeon while the patient is on the operating room table, then there would be someone there to take over in that event. The second surgeon is also there to help and assist in doing the procedure. Like I said, the procedures are complex and you can't do it alone. So basically you need someone who's familiar with what you're doing and how to assist in doing that procedure. The vast majority of our patients are done using traditional bypass. In that procedure, we're doing an open heart. We stop the patient's heart and go on cardiopulmonary bypass. So the machine oxygenates the blood as well as circulates the blood through the patient's body while the heart is stopped. And that allows us to do whatever the procedure is without movement and without blood in the field, so that we can have the best possible visualization of the structures that we're operating on. So those are the vast majority of the cases are done that way. In selected patients, patients who have good anatomy or who have targets that are in a location that we can do this as a beating heart surgery. Basically, the heart continues to beat. The lungs are still oxygenated and ventilated during the procedure, so that the patient's heart is still doing all the work, and we try to work around that movement of the heart in order to do the bypass surgery. It's kind of like working on a car with the engine running, is one way that you can describe it. It's a lot more challenging to do it that way, and of course the patients have to be healthy enough and good enough shape to be able to tolerate that type of procedure. The key benefits are that patients recover quicker, they have less blood loss, less transfusion need, less pulmonary problems because they're not on the ventilator as long. Now, some patients are not good candidates to have their surgery here because their risk of complications are quite high. In patients who have had heart attacks and their heart has been damaged, the ejection of the heart or the squeeze of the heart is not normal. Patients who have renal failure, patients who have problems with their lungs because of long time smoking or COPD or emphysema. These types of patients with multiple diseases in addition to the heart disease that pushes their risk of dying up well above 5%. Those patients we typically will sort of work with the cardiologist here and then discuss it with the surgeons up at Duke and decide whether or not to transfer that patient up or to keep them here in order to have their surgery. One of the reasons why I went into medicine was being able to help people, and it's anytime you're able to help someone through an illness or to get them through a heart attack by performing surgery and reestablishing blood flow to the heart, I don't think there's a better feeling in the world. We have performed surgery on patients or people that I knew from my childhood, and you know, they're so appreciative of my coming back and being here available to provide these services. And you know, I think it was the correct decision to come back and to be where I grew up and providing these services.